Hi, I'm Dr. Patrick Abbey with the Maxillofacial Surgery Center in Tampa, Florida. Giving a little bit of a brief overview in this video of issues that fall under the heading of TMJ. TMJ is really an acronym that stands for temporomandibular joint. And simply put, this is the lower jaw joint or the hinge with the base of the skull that's immediately in front of the ear. People will use the term TMJ to often denote pain or problems with the joint itself. These problems can present as pain with chewing, headaches, pain and limitation of jaw movement, or with referred pain that sometimes winds up feeling like a bad earache. These can arise from trauma to the jaw, congenital jaw problems, types of arthritic processes, or issues with a malocclusion or what would be considered a bad bite relationship. Oftentimes there's associated clicking or noises in the joint, and sometimes this is the first thing the patient notices before the onset of pain. This can be from a disc or meniscus within the joint, and this can get displaced, which can lead to the clicking or popping as the jaw moves. In extreme cases, the disc can get into a locked position where it stops moving completely and the patient's jaw feels as if it's locked or it's stuck in a certain position. Pain with these problems can arise from within the joint itself, or conversely can also be with the muscles that are attached to the jaw, and that's very common to see. For reasons that nobody knows at this time, the problems affect women much more often than men on a ratio of about 5 to 1. The ability in our office of attaining an in-office CT scan helps tremendously with the diagnosis of these problems. This is paramount in making decisions about treatment planning, as there are so many different issues that can present with the same symptoms. Often to visualize the disc in the joint itself will also require an MRI, and this would be obtained at an outside imaging center. Luckily, these problems rarely require surgery, even the patients that are referred to my office. There are numerous non-surgical modalities that are available to help with these symptoms. Most commonly, the treatment will entail the help or use of an occlusal splint or a bite guard. These are specially fabricated in a custom fashion to each individual patient, as they must have an exact fit with the bite relationship to work appropriately. Medications, physical therapy, dental restoration, and possibly even referral to an orthodontist for an evaluation may also be needed. Severe problems that do require surgery are reviewed in detail with the patients before considering that as an option. Our office utilizes a very conservative approach in this regard, and over the last 20 years I've developed a philosophy that oftentimes less is more. This means we'll use the most conservative measures possible to allow the joint to be restored to a pain-free function. Often this can be accomplished in an outpatient setting with an arthroscopic procedure and utilization of a laser, with the patient sometimes back at work within a day or two after the procedure is done. We also provide for more extreme situations, and sometimes patients' problems will require further intervention in that, and have some of the highest experience in the country with total joint replacement of the TMJ, even as rare as that's required. So overall, TMJ problems we treat commonly in our office, and oftentimes are ones that can be corrected or brought back to a fairly normal range of function and pain-free with as little treatment as possible. Thank you.